What's up everyone? Welcome back to my YouTube channel. In today's video, I'm going to show you how to complete a Kegels exercise routine to specifically help you with erectile dysfunction. And not only are these Kegels going to fix this issue, they're also going to help you get harder and firmer erections. And let's be honest, who doesn't want that? Now, if you're new here, my name is Eric. I'm a mental health physiotherapist, and this channel is dedicated to mental health physiotherapy and to helping you to overcome mental health issues. I post new videos every single week, so please make sure you subscribe to the channel by clicking the subscribe button below and join our growing community. All right, if you weren't aware, the quality of your pelvic floor muscles can make all the difference between having a softwood or a hardwood, so to speak. Now, this group of muscles are often considered as the foundation that underlies normal pelvic functions of peeing, passing bowel movements, and achieving and maintaining erections. A weak pelvic floor foundation is undesirable, as this can significantly contribute to both erectile dysfunction and urinary incontinence. Strengthening this foundation of the pelvis, the pelvic floor muscles, provides an element of protection against and can be used to improve these unwanted symptoms, even if they've been long established and going on for a really long time. Discover how utilizing pelvic floor exercises to strengthen this foundation to improve erectile dysfunction over the long term. Pelvic floor exercises have been long recommended as a first choice treatment strategy for erectile dysfunction, and this is due to its relative ease of prescription to patients, being cheap, less risky of causing harm like medications potentially carry. Now, although this recommendation is also based on the substantial evidence indicating that men who have erectile problems also demonstrate poor pelvic floor muscle function. This especially applies for men receiving prostate cancer treatments, although this also relates to all men experiencing any erectile dysfunction problems. Take prostate cancer, for example. During prostate cancer treatments and the recovery from treatment, it is common to have widespread loss of muscle strength and size, of which the pelvic floor muscles are no exception. And after the surgical removal of the prostate, a large portion of men are left with erectile dysfunction, which is in part attributed to associated changes in the pelvic floor strength and control. Now, research shows that men who completed sufficient pelvic floor muscle therapy after a radical prostatectomy were more likely to report improvements in their erections compared to men who didn't. Additionally, men who receive radiotherapy don't escape these troubles either. A known consequence of radiation is long-term pelvic floor function changes, including a reduction in normal activity and maximum contraction strength. Now, although they're rarely recommended, the use of pelvic floor exercises has been strongly advised after radiotherapy and for the management of erectile dysfunction too. Now, when we're discussing the best way to complete a pelvic floor program and for how long remains unclear, but this should be based upon your individual ability and your situation, because the research provides some guidelines here around what has worked previously, showing that a period of at least 3 months is required to see some good results. This time frame is critical for your nervous system to learn how to efficiently isolate these muscles and give enough stimulus to get them bigger and stronger. Therefore, your pelvic floor strengthening program must go through a series of phases, progressing from learning how to contract these muscles all the way to mastery. Remember, you can't run before you've learned how to walk. And equally important is manipulating how hard you contract and how often you complete these exercises, because this too needs to be challenged throughout a program to achieve full fitness of your pelvic floor muscles. Now, you're probably wondering, how do pelvic floor exercises improve erectile dysfunction? And to begin to understand how pelvic floor exercises work to improve erectile dysfunction, it helps that you understand the causes in further detail. Dysfunctions can occur when there is a lack of ability in activating and controlling the pelvic floor musculature, and therefore having reduced strength. The impairment of your ability to contract your pelvic floor and having less strength is known to contribute to reduced erection strength and control of your ejaculation. Naturally, there are a lot of aspects involved in the ability to achieve erections, where the pelvic floor has an important role. Naturally, as things get hot and heavy in the bedroom and arousal occurs, there is increased blood flow entering the penis, which is coupled with the simultaneous mechanisms to reduce blood being taken away from the penis, allowing you to stay erect. Contractions of the ischiocavernosus and bulbocavernosus muscles improves erectile hardness by preventing blood loss from the penis, temporarily blocking the veins that drain blood away in a flaccid state. And this can be compared to blocking the drain pipe when the tap is turned on to fill up the sink. So by improving the ability to contract these muscles can help establish and maintain sufficient hardness of the erection for penetrative intercourse. And pelvic floor training has been demonstrated to be effective for building size, strength, awareness, and ability to activate these very important muscles. However, being consistent with your pelvic floor routine is critical to achieve desired outcomes, with a lot of men lacking the motivation, not seeing the long-term benefit, or simply forgetting to do their exercises. And even though it can seem like a long road ahead and you may feel guilty having a wavering level of commitment to a pelvic floor program, the end goal is to use these small daily habits to get a harder erection. And if you haven't started this process yet, start implementing a daily pelvic floor strengthening routine today. Oftentimes, you won't even realize how insufficient your pelvic floor muscle strength is until you start. And if you're looking for my top pelvic floor strengthening program, I've created the perfect video just for you. I'll link it above and below in the description for you to go check out. And that's gonna wrap up today's video. Erectile dysfunction can cause you some serious stress in both your personal life and in the bedroom. So it's worth doing everything possible that you can to help improve your situations. In this video, I went through why strengthening your pelvic floor muscles is so important in the journey to achieving harder erections. I also want you to consider visiting your GP, as they can prescribe you medications such as Viagra or Cialis, where combined with a pelvic floor strengthening program, you can achieve the results you're after much quicker, as the medication improves the blood flow to the penis and the pelvic floor exercises improves the strength of the exercises that are actually causing the erections. Now, yes, nerve control is very important, and if you've had a surgery that have affected this nerve control, it's gonna take you a little bit longer, but don't lose hope and still try everything that you can. And thank you all so much for watching. I hope you enjoyed the video, and if you have any questions at all, please leave me a comment on this video below. And if you haven't already, please consider liking this video and subscribing to my YouTube channel. It would really mean the world to me. And lastly, regardless of your situation, keep going, and I'll see you in the next video.